This is the Practice of Therapy podcast with Gordon Brewer. This is session number 56 of the Practice of Therapy podcast. Hello, folks. I'm Gordon Brewer, and I'm so glad you've joined me for this episode of the podcast. If this is the first time for you listening to the podcast, glad you found us here and hope you'll keep coming back and do take some time to subscribe to the podcast. You know, as I say most in the introduction of most of these, I really hope that this information is helpful for you and that you're finding this podcast helpful, because that's exactly why I do it. I want it to be useful information and want it to help you in your journey wherever you might be, particularly those folks that are in private practice or thinking about going into private practice. You know, it seems like it's just kind of chit chat to talk about the weather, but I do have to mention the weather today. It is absolutely awesome. But fall, I think, is my most favorite time of the year as far as seasons go. And there is that crispness in the air. And after several months of hot weather, I just absolutely love it. And looking forward to the weekend ahead. Generally, I record my podcasts on Friday, and that's the case today. And looking forward to the weekend. And I hope you, depending on when you're listening to this, I hope that you're doing some stuff that's fun for yourself. I think a lot of times, particularly in our field, we need to take that time to recharge our batteries and take some time off. And that's what I try to do on the weekends. It's the main reason I went into private practice, is so I could determine my time off and being able to have that freedom and that flexibility. So hope you're doing the same out there. You know, a lot of things have been on my mind lately, as many of you have heard in the last few episodes. I've been focusing on finances primarily, just because that just seems to be something that a lot of people are thinking about and responding to me about, and I'm getting a lot of feedback and questions about that from people as we go along. I know one of the things that I do that I would encourage you to do as well is there are so many online networking opportunities out there, particularly on Facebook. I'm a member of several different Facebook groups, and I'd like to. I'm trying to list them off. There's the Group Practice Exchange. Maureen Warbuck, who was on an earlier episode of the podcast, she's got a great Facebook group. Another one is Abundance Practice. Allison Pereira. Allison is just a delight to get to know. And again, she's been on the earlier podcast episodes. There's also the Insurance Credentialing Group. That's Danielle Kepler. That's I think I'm getting your name right, Danielle. You've got a hyphenated last name, and so I might have that wrong. But anyway, my point is that I do a lot of networking online with other people in private practice, and I would encourage you to do that. I've also got the Practice of Therapy group on Facebook, and a confession here, I've not been as good about engaging with that. I like social media, but I'm a reader of social media because I read what other people say, and then I'll comment and add things. But I'd like to invite you to just join the community I've started there, the Practice of Therapy community. I've got the Practice of Therapy, Facebook page. Invite you to follow that and give it a like. And I just try to post stuff that I find that's relevant to private practice on there, give people access there. But the community, which is a separate group, private Facebook group, you actually have to request to join, and there's a little questionnaire there where I ask you, I think, 3 questions about your journey. And that way, I really kind of weed out people that are just trying to spam or whatever. But that community is really there for people to ask questions and to be able to engage with other people. And not that it's any better than any of the other groups out there, but I've just got that out there as another resource. And speaking of resources, one of the things that I've was working on earlier today or earlier this week was really making some updates to my resources page on the Practice of Therapy website. And so if you go to practiceoftherapy.com and just up there near the top of the page, you'll see a button for cool resources. And I've recently added 2 resources that I really like and that you've heard me mention before. And actually, that I've had the owners of those resources here on the podcast. And that's one being Practice Solutions, and they do help with insurance billing and insurance credentialing and help people really navigate all the way through that whole insurance piece if you're going on insurance panels or starting to do insurance billing. And the other one is Practicat with a K, and that is Katie Englert's site, and I interviewed Katie, I think, 2 episodes back. And what she's really done there is she's tried to make it a all-in-one place for you to find resources for your private practice, whether it be paperwork or courses or handouts and all of that sort of thing. And I'm going to talk a little bit more about that in this episode. So anyway, in today's episode, again, it's you're going to get to hear from me solo today. I've got some other folks lined up for interviews coming down the road, but just in my schedule or whatever, I kind of hit a lull here where I didn't have anybody necessarily scheduled to interview. But what I thought I would talk about today is just about setting your fees and then also ways that you can diversify your income streams in private practice, and some things that I've found that works for me and diversifying my income streams, but also talking about that important piece of setting your fees, because I get a lot of questions about that as well. So without further ado, here is, we'll jump into this and talk about this a little more, setting fees and diversifying your income. You know, a little bit of my own story in private practice. When I first went into private practice, oh gosh, it was probably around 2005, 2006, somewhere in there. I was still working for an agency at that point, and I really started my practice really in the context of what I was doing through some of my church work. And so what I thought I would do, what I did at the time was started my private practice really as a counseling ministry within the church that I was a member of at that time, and didn't really think, I was going to do a whole lot with it, but it was just something that I felt kind of led to do or called to do, however you want to phrase that. And so what I did is approach the vestry of my church about setting up a counseling ministry or a counseling practice within the context of the church. And the premise is that it would be self-supporting. In other words, the church was not going to have to pay anything in order for me to have the practice, but but also I was going to give back to the church a portion of what I would collect from potential clients within the community, but also offer that as a service to church members at no cost, a certain number of sessions or whatever. But, looking back on that time, one of the things that I probably did wrong with that is I set my fees way too low. Of course, a lot has happened since 2005, 2006, whenever it was that I started that, and things have changed so much for me in my own practice and my own journey. But one of the things that I think a lot of us do, and particularly folks that are just starting out in private practice, and also maybe people that are just getting going, is that they undervalue the value of their time. Now, I realize that some people might be just right out of graduate school, and so there is some sort of a mindset. I don't know how we develop this mindset, but I think it's one that we need to do away with, is that if you're not as experienced, you're not as valuable to people and what you do. And I would say that's a myth, and I think we can dispel that myth. One of the things about it is that I forget the exact statistic, but when you look at, particularly here in the United States, look at education levels and look at what people that are, number one, just simply college graduates, in other words, bachelor's level people, that's one level. It's less than the majority of the people in the United States have bachelor's degree. When you look at an advanced degree, a master's degree or higher, it's down in the single digits in terms of the percentage of people that have those advanced degrees. So one of the things that I would encourage you to do in thinking about your mindset about that is that if you are in working towards licensure or are licensed already, the requirement for that for anyone pretty much in the United States is that you have a master's degree. And so that in and of itself, your educational level is much more valuable than maybe you realize. And so I would just commend that to you. One of the things too about this whole what your value is, I think a lot of times we get stuck with what I call an imposter syndrome. In other words, we don't recognize our own value and our own knowledge and what we do know. And I know that's something I've had to struggle with over the years, is really recognizing that, not to brag or anything, I'm a pretty smart guy. And part of it is just by virtue of luck of the draw, the family I grew up in, and that both of my parents were college educated, and the expectation to go to college and, further go in, even getting an advanced degree was just kind of laid out there. And so that is something of a value. And I would say don't discount yourself around that. So in thinking about setting our fees and thinking about my nose is itching, so I'm going to scratch it. Sorry, that's probably a little more information than you needed. But anyway, thinking about setting our fees, one of the things I think the place to start is to really begin to think about what sort of lifestyle you want. And I'm not talking necessarily about the money, but thinking about how much time you want to spend on the job, how much time do you want to have off, and what you want to gain out of being self-employed and having your own practice. For most all of us, I think most of us go into private practice. The typical story is that people get their experience and they learn the whole craft of doing therapy, doing counseling by working in places like agencies where you really get inundated with how to do therapy. And I think all of us ultimately develop our own style around that. But the typical story is that most of us get to a place where we're kind of burned out with working for an agency. In other words, the caseloads are high compared to what we're gaining financially from that. And the other thing about that is that even if you're making a whole lot of money working at a place like that, you don't get the time off that you need. You don't have the time with your family that maybe you want, and your schedule is just very demanding. I know when I was working for an agency, my typical week was a 60-hour week. I mean, even when I was trying to work my best at being efficient in what I was doing, I was still spending my weekends getting caught up on paperwork and session notes and treatment plans and discharge plans and all that stuff that you have to do that's part of being in practice, but it was just eating away at my time, not to mention being on call and being available sometimes 24/7. And so I think all of that can kind of take its toll and really is a big motivator for going into private practice. So as you always hear from me, I think the big place to start is why. And so when thinking about setting your fees is the place to start is looking at how many clients you want to see in a particular week. I know for me, my ideal caseload, and I'm really starting to back away from this a little bit as my practice grows and I'm having to spend more time on doing administrative stuff and spending time on doing things like the Practice of Therapy podcast, which I absolutely love doing, and all of those sort of things. My typical caseload is anywhere from 15 to 20 a week. And so as I think about that, if I were a solo practitioner, I would need to set my fees at a place that would allow me to have that caseload plus get the income that I needed for that. So I think a place to start is to really think about, first of all, how much time you want to spend in sessions, how much time you need to do the paperwork and all the auxiliary stuff that's involved in running a practice, and as far as the administrative side of things, the business side of things. So start with that. Then and then you just work backwards based on what you would set as your salary. So if you were to do, I'm going to pull up a thing. I did a blog post a few years ago just around this whole topic of setting fees. And I'll be sure to have a link in the show notes that'll get you to that older blog article that I did on setting fees. But if we were to use the examples I used in that, let's take, for example, you wanted to make $50,000 a year just as a salary, throw that out there. So if you were to divide that by 52 weeks in a year, that comes out to $961.54 the income that you would need, gross income, just for that figure, $50,000 per week. But as I said in the article, you probably want to take some time off. So if you were to divide that by 48 weeks, which would give you essentially 4 weeks of vacation, which I think is a reasonable amount for most people, that would come out to $1,041 in about $1,041 per week income that you would need. So if we were to work backwards from that, you would also need to take into account how much of your monthly expenses you need for running your office. In other words, you've got to pay for your office space. You've got to pay for phone, electric, office. You maybe ask some admin help, all that sort of thing. So I think in the example I did here, I came up with just kind of a rough monthly expense figure of $1,067. And again, we'll have the show notes here. So if you add what you would need on a yearly basis, and you would add to that $50,000, let's see, $1,067, and I'm sure a lot of your eyes are glazing over as I'm talking about numbers. No, mine do. But so anyway, so if you do the math, comes out to $22,404 worth of yearly expenses in this example. Then you would add to that your $50,000. So what that translates to is that you would need to bring in a total of $72,404 of income in order to pay your salary, to pay your taxes, to pay your monthly expenses for your business. So working backwards from that with the $72,000 figure, $72,404 figure, if we were to divide that out by sessions per week, again, assuming that we wanted to only work 48 weeks, Again, I'm not going to try to tell you all the math, but basically the session rate, if you were going to have only 10 sessions a week, you would need to charge $150 per session in order to getting 10 sessions per week. If you did 17 sessions per week, you would need to charge $90 per session. And if you were to do 22 sessions a week, you would need to charge $70 per session. Again, we'll put in the show notes the link to this page so you can kind of get the visual there. But as you can see, obviously it's pretty common sense and really just kind of some easy math if you work backwards. You just look at the total amount that you need to make, then you divide that by the number of weeks that you're going to work, and then you divide that by the number of sessions that you would want to have ideally per week. And, on paper that all works out, but then again, you got to take into account things like no-shows and missed sessions and that sort of thing. And then also being able to determine whether or not you could charge, for example, $150 per session. In some areas of the country, that is a low figure. For folks like on the West Coast, probably like in the San Francisco Bay Area, probably more of a norm for an average per session fee would be $250. Where you take where I am here in East Tennessee, probably more of a norm of a typical session per session rate would be in the low 100 range. So depending on your demographics and where you are in the country is going to determine your fees as well. But anyway, you can kind of get at what I'm going on here is that you need to really kind of look at running some numbers and really doing those calculations to kind of figure out at least a ballpark of where you want to be with what you charge for sessions. The other thing about what you charge for sessions, I mentioned really looking at the demographics of your area. One way to kind of get an idea of kind of the average rates per session for your area is to use like Psychology Today. If you'll go do a search for your area, most people have listed on there what their per session rate is, or at least a range for that. So you can kind of see where you might fall on that range. One of the things too that you have to take in consideration, obviously if you are not on insurance panels and you're in an area where you're able to operate without having to, in other words, you can be strictly private pay, cash-based business, that's going to be easier and less complicated. Unfortunately, though, not everybody lives in an area where that is an easy road to hoe, so to speak. So if you're on insurance panels, it's kind of, in many ways, kind of a game changer in the way that you have to calculate all this out. What I've done, what I do when I figure out I'm an insurance-based practice. So what I've done is over the years is I've collected data. And if you'll go back to last week's podcast episode, there's a free financial analysis guide that you can download. And we'll put links again for that in this, where I talk about how I go through that. How do you do that financial analysis on your practice? But one of the things that's real important to figure out, especially if you're on insurance panels, is find out what your average per session rate is, because it's going to vary from insurance company to insurance company, because you have to sign a contract with them and they set the rate that you get per session based on that contract. So usually that's going to be a bit lower, and hopefully you're in the 3-digit range with those per session fees, but we're not, because of the contracts, we're not supposed to to share what our contract rate is. It's all the contracts. It's pretty plain in there, but I would say a range is anywhere from $50 to a session, which is really low, to probably 125, 130, maybe even 200 in some areas per session, depending on your contract rate. But my point is that to figure out what your average is, and then using the same formula, you can figure out what number of sessions per week you're going to need to do in order to make the salary that you would like to make with your practice. So the other thing I'll say about insurance rates, I think it's a good idea every now and then to go through and look at the panels you're on and decide whether or not it's worth it for you to stay on those panels. There have been some panels that I've been on in the past where they had a low rate, but when I looked at the number of clients or number of patients that I got from those panels throughout the year, it was not worth it for me to stay on that panel. So when the contract ended, I just didn't renew with those panels. And the other thing to realize too is that for some insurance companies, you actually get paid better if you're out of network. And that's what we found here in my area. There's one particular insurance company, I think they've been courting us to be on their panel, but we're not getting on the panel because the out-of-network rates are better, and they're paying the out-of-network rates to us. It might be a little bit more costly for the client in that they've got they might have a higher copay with out-of-network benefits. But anyway, all of that you need to average out, figure out what your average cost, per session rate is. Another part of setting session rates that a lot of people do, and I know this is something, again, that I offer in our practice for people that, since we are primarily insurance-based, I realize that there are people that are going to come to us that couldn't afford our full rate. And let me, a little side note on that about the rate. Set your rate high enough to where, regardless of which insurance company you send it to, you're going to get their full amount. Always put on, and most billing people will always tell you this, when you're sending in a claim to the insurance company, don't put on that claim your contracted rate with that insurance company. Put your full rate on there. That way, if there's any changes, you can reap the benefit of that. They're going to discount it out anyway. So a lot of times people don't know that kind of fun fact, and that is to put your full rate, whatever you set that as, on your insurance claim when you send it into the insurance company. And like I said, they're going to discount it out to adjust it out to their contracted rate anyway, but put your full rate on there. So, but what I was going to say is the other thing is being able to, for some places, it's might be a good idea to offer a sliding scale fee. And there's lots of reasons, pros and cons around that. The main one, I think for me, with the sliding scale fee, we live in an area of the country that is kind of middle to lower socioeconomic kind of demographics. And so I just felt like ethically you needed to offer that to people, especially people that do not have insurance and don't have any sort of third-party coverage, is to offer that sliding scale fee. When I say a sliding scale fee, what that means is that a person pays that we set their per session rate based on their income. So ours is like a 3-tier sliding scale. It's the lower scale, as I think, is up to if a family is making less than $40,000 a year, they get the lower fee. Then there's a middle range there, and then an upper range which is our full fee. But with your lowest range, what I would do is set that fee close to your average per session rate. Then if you get people that don't have insurance, or you're doing you can do it on a per case basis, but really kind of set that there. That way you know that regardless of which clients you get, you're not necessarily going to get your full rate, but at least you're going to get the minimum that you get with insurance. So that's just a little tip on setting a sliding scale fee. And I would say don't make it overly complicated. I know at one time I had a sliding scale fee that was, had like 4 or 5 different levels to it, and that's just too much. Just keep it simple, maybe 3 different levels with that, and just looking at the demographics of your area and what you feel like people can afford. So hopefully that gives you some ideas about how to set rates. Next, let's jump into talking about some ways that you can diversify your income. One of the challenges for us, those of us in private practice, is that we're very much, especially if you're in a solo practice, we're very dependent on being able to see clients in order to produce an income. After all, if we're not seeing clients, we're not getting paid for the sessions we do. We don't have the income. And that's why it's so important to be able to look for ways to diversify your income in private practice, particularly finding ways that you can create streams of passive income. And what I mean by passive income is really doing some things that will generate income for yourself, where you might put a bunch of work in on the front end, and then you have something in place to where you get additional income. Some typical ways of doing this. One website I will point out to your podcast, one that I listen to all the time, is one called Smart Passive Income, a guy by the name of Pat Flynn. And if you've listened to Joe Sanok, some of his older podcasts, he's had Pat Flynn on that. But I listen to Pat pretty much every weekend because it gives me a lot of ideas around being able to make the practice of therapy better, and being able to market it better, and being able to get resources to people. But the idea behind passive income is that you put something in place. And some typical ways of thinking of passive income are things like writing a book, where it's out there on the internet and people buy the book and you get some income from it. Other forms of passive income is something called affiliate marketing, and that is in one of the best known ways to do affiliate marketing, or one of the best ways, is to become an Amazon associate. And through Amazon, what you can do is set up on your website just a shop or ways, and you see it from me all the time. I have Amazon links and books that I suggest, and every time somebody buys one of those, I receive a small commission for that. And I like to be transparent about that. I'm not trying to make that a big secret or whatever, but it's not a huge commission. It's a few dollars per book. But regardless of that, if somebody buys on Amazon, they pay me that small commission for what they buy. The other great thing about the Amazon associate deal is if, for example, somebody used the link to buy, say, a book on my site, but then they said, "Oh, I need to buy a refrigerator or a big ticket item," I would also get a commission on that. Unfortunately, that's not happened for me yet, but who knows? One day it might do that. But the good thing is on the consumer side is that it doesn't cost any extra for the consumer. So they click on the link, you get paid a commission. So that's a form of passive income that you could incorporate, particularly on your website, for your practice. I know for my private practice website, and in fact, that reminds me, I need to update it. I've got like a bookstore on there, and I've got pretty much all the books that I like to recommend to clients. And I tell them, if you'll go to the website, I've got those books listed and you can buy them from Amazon there. Again, I'm fully disclosed the fact that I get a commission for that, but, I don't think it really, it's not any huge deal for people. Another big way to receive passive income, and this is especially for people that are really starting to grow and scale their practices, is when you add clinicians, and that depending on how you set that up, whether it's a co-op model or whether you do a fee split or you hire people as an employee, you get a percentage of what they bring in some form or fashion. And when I say a co-op model, what I mean is that a lot of times people will just decide to share an office space. And when you reduce your costs on something, again, this is kind of common sense math, that just increases your bottom line. And so by sharing an office space with somebody, you get to keep more of what you bring in. Some other ways to think about diversifying your income would be to do groups. If you think about it, if you like doing groups are a great way to get more bang for your buck. In other words, you might not get as much for individual participant to be a part of the group, but it's going to be a better use of your time. In other words, you're going to get a bigger return for your time by holding groups. You'll get more when you add all the fees together, you get more. So that's another way of diversifying your income. Another way that you can diversify your income streams, and again is getting more money for your time, is to look into doing intensives. I'm working on getting a friend of mine, Tina Weiner, to join me on the podcast. And Tina has built just a very successful practice and being able to offer a couple intensives. And it's really interesting to talk about that. And the thing that's great about intensives, and just like it says, is that you spend like a day long session with a couple or with an individual around a particular issue, and you're able to get much more money for your time. So again, the point being with being able to diversify your income is looking how you're going to get the most for your time, but also that whole passive income piece where you put a lot of a lot of time into doing, setting some things up so that it brings income for you later. Another way to do passive income is to create courses. And again, that's one of the models that I use for the practice of therapy, is setting up courses where I teach on a topic and people pay to learn about that topic. And it's just a great way to diversify income. So think about all of those things around your different income streams, to thinking about setting fees and all of those things that are involved with that. Setting your fees, again, to just kind of recap, I think it's good to work backwards. Start with what sort of salary you want to set for yourself. Then figure out what you think your average per session rate will be or could be, and to be able to kind of work backwards from that to figure out the number of sessions you need to do each week, and plus take into account the time off that you need and the expenses that you need to keep your office open. It's really about crunching the numbers, as you've heard from me before. By knowing your numbers well, it'll give you a kind of a path forward of knowing ways that you can set your fees. And then also being able to bring in other streams of income to kind of augment and support that, particularly for those times when you might have a slow period or when, so you're not totally dependent on just trading your time and expertise for money, of being able to create those things and produce those things that are going to bring in other forms of income. So, that was a lot in a short period of time. I know I just kind of rattled off a lot of things there, but that was one of the things that I thought I would want to talk with you about today. Hopefully this has been good information for you. And again, if you have questions about any of the things that I talked about, feel free to shoot me an email. I try to do a good job of responding to those emails. Gordon at practiceoftherapy.com. And also, as I mentioned at the beginning, go over and take a look at the Practice of Therapy community on Facebook. And you can join that and we can start a discussion. I think that's a great way to get not only comments from me, but also get comments from other people that are in private practice, maybe in the same boat. I don't have all the answers, so I think it's a good idea to kind of look in other places as well. So again, hopefully this has been good information for you in this episode. Well, folks, I hope this has been helpful for you. In many ways, this was just kind of an impromptu episode and some things that I was thinking about this morning and just in my contemplation time at home and just thinking about my day and planning my day. And I realized that this has been a topic that I haven't really talked that much about, is how to set your fees and also thinking about ways to diversify your income. Do go over and check out the show notes on this episode, and I'll have those links in there to that older blog post that I did about setting session fees that'll give you some ideas around that. And also there's another blog post on diversifying your income that I did early on. And it's got, I think, in there a list of things, and I'll make sure we get that in the show notes as well. I know I mentioned at the beginning of the podcast again, and just kind of tagging on here, one way to maybe get some ideas about other ways that you can diversify your income was one of the resources I mentioned at the beginning, and that's Practicat, and it's just Practicat with a K, practicat.com. Go over and take a look at that platform. I would really commend that to you, not only for finding resources for your practice, but might give you some ideas around ways you can diversify your income using that platform. I know, like, for example, if you got some handouts or presentations that you have worked on and done and proud of, you could actually sell those to people. And I know Katie Englert over there at Practicat is constantly looking for therapists that have resources that they want to share. And she's set up the platform so you can sell them there, and you could get some passive income from that particular platform. So check that out. I'll commend that to you. So also go over, as I mentioned, I've got resources on my website on the Practice of Therapy. Check those out as well. I'm adding to those all the time. I know I've got links for Practicat and also Practice Solutions in there under cool resources. So just go to practiceoftherapy.com and then click on the button there near at the top that just says cool resources, and you'll be able to find that it's one of the most visited pages on the website. So so I just commend that to you. So again, folks, hope this episode has been helpful for you, and I'm starting to get some exciting guests lined up. I've got Cecilia Brasino coming up on one of the next episodes. And Cecilia is going to talk about, again, this is another way to think about diversifying your income. Cecilia was on an earlier podcast episode, and she has launched a new training that she's going to be doing immigration assessments. So looking forward to that and talking to Cecilia about that new resource that she's getting ready to get out there, of training therapists about how to do immigration assessments, and being able to add that as another stream of income to your practice, and particularly for those folks that might be interested in that. So that's coming up in one of the next episodes of the Practice of Therapy podcast. Do take the time to go over and subscribe to the podcast wherever you might be listening, whether it be on Apple Podcasts or AKA iTunes, and Google Podcasts, or Stitcher, or Spotify, or iHeartRadio. I think I've got them all there. And now on Amazon too. If you go to, I think it's the Amazon Echo podcast, you can get us there as well. So I was excited to be able to find out about that and get the stream out there as well. So take care, folks. Let me hear from you. Join our Facebook community, the Practice of Therapy community on Facebook, and look forward to hearing from you, folks. Take care. Have a good, great rest of your week or weekend whenever you might be listening to the podcast. Take care, folks. You have been listening to the Practice of Therapy podcast with Gordon Brewer. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. If you haven't already, please sign up to receive the free Private Practice Startup Guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the host, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.